Mercy Women's Catholic Hospital is a fistula center, one of the biggest in West Africa. And we attend to general patients as well, but we are well noted for caring for women with obstetric fistula.
Mercy Women's Catholic Hospital Mankesim has been in operation for a barely over a decade. We are into general medical care, and we also specialize in obstetric fistula repair. For the past years, I think we have been able to repair close to 800 obstetric fistula surgeries, coming down from almost every part of the region. I mean, all the regions in Ghana, and then also from the neighboring countries.
Obstetric fistula, it simply means they have a connection between the bladder and then their private part. So patients with that complication during childbirth are referred to as having obstetric fistula, and they continuously leak either urine or feces from their private part.
Some point 2016, 2015 thereabouts, we used to have a lot of clients coming down from Burkina Faso, coming down from Togo, Cote d'Ivoire. I mean, the number coming from those those parts of the countries have gone down as a result of issue of transportation, access and those things. So we, through the Ministry of Gender, somewhere 2014, helped in mobilizing clients all over Ghana to Mankesim for the repairs.
We have a little bit of challenge with respect to theater equipment, especially because of the work that we do, and it's quite difficult to purchase those equipment, as we normally don't have the resources to do that.
We have a lot of challenges because, looking at the nature of the care that we give, people do not really have the financial stance, to pay for the medical, the surgeries, and the upkeep and everything.
Most of the patients that we care for really are not well to do of, so we have to solicit for funds and take care of such patients. I must say that quite a number of organizations and companies have been very helpful, Access Bank and a whole lot of other companies. But we will always ask for more, as the challenge is quite enormous and we need quite a number of resources to take care of women with obstetric fistula.
So what we usually do as a center is to mobilize for funds. Once we are able to get funds from people, then we bring the people that we have been able to, gather for surgeries. And our surgeons are usually from Konfanochi and then Kolebu Teaching Hospital. I mean, Kolebu Teaching Hospital has been one of our main stronghold in terms of the fistula surgeries that we do in Mankesim. We have a couple of other challenges, with regards to the operations that we do. Some had to do with logistics. Some had to do with medical equipment. At the moment, we have only one anesthetic machine, which is virtually broken down. Sometimes when the doctors come, they want to do more surgeries because of the number, but they are limited, in undergoing those surgeries for the people because of the limited resources or equipment available to carry on with the surgeries. So we are always, asking for help. not only financial help, I mean, as in for the repairs, for the medical bills, but also equipment to help in, undergoing the surgeries. So that one is our major challenge. One other challenge that is so crucial to us is, reintegration as a key issue, because most of these people happen to be women who are neglected in the societies. So they don't really have anything for themselves. They don't have anything doing to keep them, to keep them living. So when we are able to educate them, letting them know that their conditions are not so bad that medically we wouldn't be able to repair, and they come, going back to the society, what can we then do to help them to get themselves established? So we have a unit at our hospital where it's supposed to give these people some kind of training, like catering, like weaving, sewing, and all those things. But the resources for the establishment of those things are also not available. So sometimes when they are done and they are going, the question is, how do we sustain these women? It's also another great challenge. How are they going to fend for these kids through which they had the obstetric fistula? And so what can we do as a hospital and as a nation? Sometimes we give them tokens as something to feed on, but it wouldn't be anything that can keep them even up to a month. What happens after a month? Even if you should keep them up to a month, what happens after a month? So these are some of the things that we currently face, in our attempt to help in bringing women from these miserable conditions to their normal living. And Mankasim happens to be a very industrious community. And as a part of our challenges, we have had a lot of series of encroachment also on our land. And so it is also giving us even the room to operate well. But we believe that with a lot of facilities that we have, going as far as to repair, we have a bed capacity of 45 for obstetric fistula alone. And I must say that our hospital happens to be the only hospital in the country dedicated for obstetric fistula repairs. And so we want to do more. Currently, the Ministry of Gender, Children's Social Protection, they have, identified our facility as a training center for obstetric fistula repairs. And so they want to, enhance the services that we have, the facilities that we have. And so they even want to, create more avenue for people to come from other places to be trained here, so that together we can help in combating the issue of obstetric fistula in Ghana. But the truth of the matter is, now fine, the project has started, but sometimes you wonder, what commitment can the community also give to support the work that we are doing as a center? Definitely the issue of encroachment would not permit us to excel, and so we are pleading that the public should desist from, encroaching on our hospital land, so that we want to do more. The hospital is noted for very big, work. We do a lot of things, and we are not the district hospital, but we are doing better. Comparatively, we are doing very well. And so we want to do more. We are ready to work more. And then it is out of our service that Teresa, for instance, has been noted as the best national nurse, first runner-up, being a second person nationally as a nurse. So you can see the kind of work, commitment, management are putting in place, mentoring people, doing everything possible to keep the human resource aspect also solid enough for the service that we render.